Hello guys, in this video we'll be talking about the hernia. So I'll tell you about the mnemonics that are named hernia. What is the location of superficial and deep inguinal ring? They are defect in which layer, which I got confused very often. Like either it is a defect in external oblique or the fascia transversalis. I'll talk you about the G-band test, then the deep ring occlusion test, and the examination of hernia per se, guys. Okay, so see, this was a patient that presented when I was posted in surgery OPD, guys. Okay, so you can see he had a bulge here, guys. Okay, and you can see the patient present with the bulge, guys, and the patient gives a typical history that on cuffing the size increases, and most of the patient will give a history, guys, like they can manually reduce the size. Okay, so this is the clinical feature with which the patient present, guys. Okay, in your mind one of the DDs is hernia, guys. Okay, so we'll talk about how to go about with the case, guys. Okay, so see, first of all we'll talk about the rings, guys. Okay, we need to know that there are two types of hernia, guys. One is the indirect hernia and other one is the direct hernia, guys. Okay, so see, first of all we'll talk about the ring, guys. There is superficial inguinal ring, guys, and there is a deep inguinal ring, guys. So like we always get confused, guys, either it is a defect in which layer, guys. Okay, so think, guys, deep inguinal ring, guys. Okay, so this deep inguinal ring, guys, D, E, and then next letter will be F, guys. Okay, so this deep inguinal ring, guys. Okay, this is the defect, guys, in the fascia transversalis, guys. No more getting confused now further, guys. This is the defect in the fascia transversalis, guys. Now coming on to, guys, superficial inguinal ring and the shape of the ring, guys. Deep inguinal ring. Okay, that can be made a O, guys. This D itself consists of a O in means it is a oval shaped opening, guys. Now talking about this, guys, superficial inguinal ring, guys. Okay, so this superficial inguinal ring, you can see ER, that is, it is a defect in the external oblique aponeurosis, guys. Okay, so what is the landmark for superficial inguinal ring and for the deep inguinal ring, guys? If we talk about the superficial inguinal ring, guys, okay, so it is located, guys, okay, just above and medial to the pubic tubercle, guys. In patient also I'll show you how to mark. Okay, now talking about the deep inguinal ring, guys. Okay, so this deep inguinal ring, guys, it is a defect in the fascia transversalis that we remembered by the mnemonic DEF. And how is it located, guys? See, you have pubic symphysis, guys, and you have pubic tubercle, guys. Okay, so it is located about 1.3 centimeter above midway between the anterior superior iliac spine and the pubic symphysis, guys. So this is known as mid inguinal point. You also have a term that is known as, guys, mid point of inguinal ligament. Okay, guys, so what is midpoint of inguinal ligament, guys? Okay, so midpoint of inguinal ligament is basically the midpoint of anterior superior iliac spine and the pubic tubercle, guys. Okay, so this is basically the midpoint of inguinal. See, we have a very important structure known as the inferior epigastric artery. This inferior epigastric artery is a demarcation, guys. Okay, see, the structures, if the hernia appears medial to this, guys, okay, then what is it, guys? Then it is a direct hernia, guys. If it occurs lateral to it, guys, then it is an indirect hernia, guys. Okay, so this is very important, guys, in order to know. See, here we have marked the deep inguinal ring, guys. What was the location of deep inguinal ring? At the mid inguinal point, that is midway between the pubic symphysis and the anterior superior iliac spine, midway between it, guys. Okay, so this is mid inguinal point, and this is the superficial inguinal ring, that is triangular shape, guys. Okay, see, now what happens, guys, is that how the hernia, how the defect comes from, which is the vacant portion that makes whether it is direct or indirect, guys. See, if we see about this photo, guys, see, here we have an opening, that is, guys, the deep inguinal ring, guys, that was oval shaped opening, and here we have a triangular shaped opening, guys, that is the superficial inguinal ring, guys. Okay, see, suppose if the hernia comes like this, it goes from the deep inguinal ring to the superficial inguinal ring, and then it comes down to the scrotum. So a patient may present either when the swelling is here only, or a part of the scrotum may be involved, or complete testis may be involved, guys. So indirect inguinal hernia, guys, may be of three variety, guys. Okay, so three possibilities are there. So what are the three possibilities, guys? That it is complete, means entire scrotum is involved, that is known as vaginal type, guys. Now if it comes but it stops before the testis, guys, that is known as funicular, guys. Okay, and what is the third variety, guys? Third variety, guys, is known as the bubonocele. That is, just the swelling will be here, guys, and the scrotum will be completely normal, guys. So this was one of the possibility, guys. Now think, what may occur, guys? This hernia, the second type, okay, direct hernia. So direct hernia is basically occurs to the Hasselbalch triangle, guys. Okay, I'll talk about the Hasselbalch triangle boundaries now, guys. Okay, see what happens if the defect occurs due to weakening of the abdominal wall. Okay, now first of all we'll talk about the Hasselbalch triangle, guys. Suppose this is the quadrant of the abdomen, guys. Okay, this is the midline, okay, guys, and this is basically the rectus sheath, guys. Okay, and here we have the inguinal ligament, guys. Okay, this is the rectus sheath, this is the inguinal ligament, and we talked about a very important structure. What was the important structure, guys? That was the inferior epigastric artery, guys. Okay, so this is the inferior epigastric artery, guys. Okay, so this triangle is referred to as the Hasselbalch triangle, guys. Okay, so this was the Hasselbalch triangle through which direct hernia occurs, guys. Okay, see. Now we'll talk about, see, first of all we'll see this image. Do you see, guys? See, this is what, this is the muscle, guys. That is the rectus abdominis muscle, guys. Do you see? This is what, guys? This is the inguinal ligament, guys. Do you see? And this part is the, guys, inferior epigastric artery. So the hernia that occurs medial to this, guys, this inferior epigastric hernia is the direct hernia, while if it occurs this side, guys, it is the indirect hernia. You can see. See, now coming on to the difference between direct and the indirect hernia, guys. Okay, this will revise in the end, guys, after we are done with all the tests. See, we already talked about the three types, guys. Inguinal indirect hernia is of three types: bubonocele, funicular, and complete. Complete testis will not be filled separately, guys. Okay, this bubonocele scrotum will not be involved, so this is only a inguinal swelling, guys. But this vaginal type, this would be inguinoscotal swelling, guys. Okay, so you need to differentiate this from hydrocele, guys. This could be inguinoscotal swelling, guys. You can see, guys, entire testis involved, testis not involved, guys, and only there is inguinal swelling, guys. Okay, see. So we'll talk about, guys, see, suppose this is a patient, guys. Okay, so we need to mark the pubic tubercle and other things, guys. Okay, so this was a patient. Basically you can see the bulge here, guys. Do you see the bulge here, guys? So this was a patient who had a bulge on the left side. Okay, he gives a typical history that, guys, he is a fruit seller. Okay, and he lifts the heavy cart and walks around 4 to 5 kilometers lifting the cart in order to sell the fruit, guys. Okay, so this was the typical history given by this patient. Okay, so see, on examining, he said that the curve it increases in size and he can manually push it down, guys. Okay, so this was the typical history, and he had a history, guys, since 4 months. Okay, so when we went on to the examination, okay, so first of all we need to mark the landmark, guys. See, this is the pubic symphysis. Okay, just above the just at the root of the if you go at the end of the penis, guys, that is the pubic symphysis, guys. Then you have the pubic tubercle. So some of the examiner like asking, guys, how do you identify what is the pubic tubercle? So when you go lateral to the pubic symphysis, guys, you get a point, and then ask the patient, guys, to flex the leg, guys. Okay, when the patient moves his leg or tries to bring the on the other leg, guys, okay, you will find the tendon getting attached to a tubercle, guys. That is basically the pubic tubercle, guys. Okay, now we are marking, guys. Okay, so we said that midpoint 1.25 centimeter above the midpoint, guys, lies the deep ring. Superficial ring is just above and middle to the pubic tubercle. You can see this is the superficial ring, guys. Okay, this is the deep ring, guys. Okay, see, now what happens? Suppose if there is a defect like this, guys, and it goes to the scrotum. So basically this is the indirect hernia, guys. Okay, and if it directly comes from the Hasselbalch triangle, guys, that is the direct hernia, guys. Okay, and you have also a point known as the saphenous opening, guys. This saphenous opening, guys, its landmark is 4 centimeter below and 4 centimeter lateral to pubic tubercle, guys. This is the landmark, guys. Okay, see, the next photo, what I have tried to demonstrate, guys, I have tried to demonstrate the 3-finger test, guys. Okay, a finger is kept on the deep ring, a finger is kept on the superficial ring, and another finger is kept on the saphenous opening. Now, guys, try to think what you will find, guys. See, suppose if the hernia is entering like this, guys. Okay, so if you have indirect hernia, guys, okay, so try to think. See, this was the index finger, guys. Okay, this is the middle finger, guys, and this is the ring finger, guys. Think, if there is indirect hernia, you have occluded the deep ring, guys. You have kept one of the finger at the deep ring, and the content in indirect hernia enter through it. So the impulse will be felt at index finger, guys. Now suppose If it was a direct hernia, guys, what will happen? So direct hernia will come from this side, guys. Okay, so where will it be felt? It will be felt on the middle ring, guys. And if it is felt on the ring finger, guys, that is basically the saphenous hernia, guys. See, this I have tried to show on a patient that has a right sided hernia. You can see, guys. So basically this is the 3-finger test, guys. Okay, one on the index finger, one on the middle finger, and one on the ring finger, guys. This I tried to show the fitting. Okay, see, this is a diagram that shows the similar thing, guys. So basically this is the marking, guys. You have the deep ring. This is the inferior epigastric artery, which is the landmark, guys. Okay, and you have this midpoint of inguinal ligament. Okay, do you guys see? Now see, now what we need to know, guys. So basically this helps to differentiate. See, guys, you have two tests that are very important. One is the ring occlusion test, guys, and one is the 3-finger test. Okay, see, this 3-finger test is also known as G-man's technique, guys. Okay, what we do in this, guys? Okay, in 3-finger test, G-man technique. See, we kept the 3 rings at 3 point. Okay, you have index finger, guys, you have middle finger, guys, and you have deep finger, guys. Okay, see, this index finger, guys, is kept at the deep ring, guys. Okay, this middle finger, guys, it's kept at the superficial ring. Okay, and this ring finger, guys, this ring finger, guys, is kept at the saphenous opening. Okay, ring finger is kept at the saphenous opening, guys. Okay, see, now we need to know, guys, what is where do you find the impulse and what kind of hernia is, guys. So it's very easy, guys. Index finger, deep ring, and indirect hernia, because hernia will enter through it, guys. If you talk about the middle one, guys, okay, so middle one is the direct hernia, guys. Okay, so this is basically direct hernia. If we talk about the ring means like this. So saphenous opening, which is basically a opening, that is a ring opening, guys. Okay, so that talks about. See, now talking about the ring occlusion test. Now, guys, try to think. We will put our thumb and it is kept on the deep ring, guys. Suppose we are occluding the ring here, guys. Okay, so basically this is the ring occlusion, guys. This we are trying to occlude the ring. After occlusion of the ring, we ask the patient to cuff, guys. If it is the indirect hernia, when you have occluded it, what will happen, guys? This won't be the hernia, the reducible hernia won't be able to enter it into the sac, guys. Okay, so basically there would be no impulse, guys. Do you see? Now suppose, guys, you have occluded this, okay, and hernia was at this point, guys. Okay, that was direct hernia. So even after occluding that, this does not cause any difference, guys. This will come down like this, guys. Okay, so basically this was, guys, direct hernia. Now see what it is written here, guys. If it is bulge medial to the thumb, that is direct hernia, guys. That is sure. If there is no bulge, that is indirect inguinal hernia, guys. Okay, so this makes it very clear. You have also a test known as the finger invagination test, guys. Okay, this test is commonly not done, guys. Okay, so this does not hold much of a significance, guys. Okay, now we'll talk about all the named hernia that may be asked in your MCQs, guys. Okay, and what are the mnemonics that will help you to remember and easily write in the exam. See, Little's hernia. Okay, so what I have written, remember that Little's hernia. Okay, I have written remember it as Little Meckle. Okay, guys. Okay, so Little Mac is a boy, guys. Okay, so basically little hernia is in Meckel's diverticulum. Okay, see, now a myant hernia. This is very easy. Appendix, or that is a myant hernia. Now coming on to the Gibbons hernia. Gibbons is 2B, guys. Okay, that means it's hernia plus hydrocele, guys. Okay, 2H. Okay, see, now coming on to the, guys, pantaloon hernia. Okay, pantaloon hernia means you have defect with 2 opening defect, guys. That is direct plus indirect, guys. 2-side problem. Okay, now coming on to the sliding hernia, guys. That is where the posterior wall is formed by sigmoid colon, guys. Richter hernia. So Richter's hernia. Okay, so Richter, some of the people live in a rich circle, guys. That is part of a circumference, guys. Rich circle, circumference, guys. Okay. Ogilvy's hernia. You live in a joint family, guys. That is Ogilvy's is through the conjoint tendon, guys. Okay. Then it is Logger hernia. Name only comes Logger, lacunar, guys. Okay. Then it is the Narath hernia, guys. Okay. So Narath hernia, guys, it is posterior to the, you know, Narath Muni, guys, like he used to tell not in front, guys, but pit piche, guys. Okay, so that is posterior to the femoral vessel. And remember, guys, this is associated with CDH, that is congenital dislocation of the hip, guys. Okay, now see, Sarafini hernia. Sarafini, name what? Inferior, that is posterior to femoral vessel, guys. Posterior to femoral. Vela pav. How I have remembered? I have remembered it as vada pav. In vada pav, if you eat, guys, vada is stuffed between the pav, guys. Okay, so this pav is anterior to vada, means that is anterior to the femoral vessel, guys. Midals, M. make it ulta W, that is a two slack loop containing hernia, guys. Okay, then Burgess hernia, guys. Okay, so what I have remembered, that is burger on demand, guys. Okay, so this is pouch of Douglas is POD, so I made BOD, that is burger on demand, guys. Okay, so it's very easy nowadays, you can get anytime burger on demand with so many online apps which you can order. Now see, if you have two triangle, one is the inferior triangle of Pettit, guys, and one is the superior triangle of Greinfeld, guys. So superior lumbar area is the Greinfeld and inferior is the Pettit, guys. Okay, see, and how can you remember if you don't want to get confused? PIGS, guys. Pettit is inferior, Greinfeld is superior, guys. So no getting confusing, guys. Okay, see, now phantom hernia, that is bulge due to paralysis. Phantom means it's not there, means that's due to paralysis of that muscle, guys. Paralysis of muscle is the phantom hernia, guys. See, now is the backward hernia. This backward hernia basically is due to opening, guys. Okay, so opening in the saphenous vein. Okay, guys, then you have a cloquet hernia, that is lies under the fascia covering the pectineus muscle, guys. Midals we already discussed, guys. You have Patterson and Stammer's hernia. If it is behind the Rook's limb, guys, okay, that is, guys, tera Patterson hernia. Stammers, that is behind the, guys, transverse mesocolon, guys. See, this is the important MCQ. What is the most common type of congenital diaphragmatic hernia? So this Boca-Dulac variety of posterolateral hernia is the most common type, guys. This is an important pediatric MCQ question, guys. And you have a Hasselback hernia. Hasselback, that is lateral to the femoral artery, guys. Okay, so this was all about the named hernia, guys. This was all about you need to know in the Zeeman test, ring occlusion test, guys. What are the various landmark, guys? What are the named hernia that you need to know, guys? If you like it, guys, please like, comment, share and subscribe. Do comment which topic you want me to do next, guys. Keep watching. Happy learning, guys.